And go ahead.
Okay, first question, what is TAVR?
Well, TAVR stands for transcatheter aortic valve replacement. It's a relatively new procedure that we offer here at Bay Medical Center for patients that were otherwise considered higher risk for traditional open heart surgery to replace the aortic valve. It's a procedure that's done minimally invasive through the arteries either in the groin or in the subclavian artery. We advance a valve that's actually adhered to a stent platform. It gets fed through the arterial system of the body across the patient's native aortic valve, which is usually tight, and once we expand the valve, the new valve starts working and we're able to relieve the restriction that they were suffering from with symptoms such as shortness of breath, chest pains, and oftentimes fainting if it's severe.
What makes this so great for the patient?
Well, we have a new valve program here at Bay Medical Center. We've been doing valve surgeries for years and years, but they traditionally involved either open heart surgery or minimally invasive robotic surgery. This offers a new procedure for patients that otherwise were not candidates for surgery. These patients are very sick, very old. They were told by either the surgeons that they would not be a candidate for surgery. So these patients oftentimes suffered with their symptoms, and we try to treat them best we can with medications, but historically they've not done well long term. So this new valve clinic that we have here at Bay Medical Center, this new valve procedure offers these patients an alternative to just medical therapy, and we know what that all entails. Usually it's not a good outcome.
When did we start doing these?
Our first TAVR patient was in February, and since that time we've done about 25 patients. We've had overall relatively great results. We've had some complications along the way, which is normal for any type of valve program or procedure, but overall the patients have done very well.
Really, I think you hit everything. You hit how it's done, you hit what it is, you hit who's a candidate for it.
We can talk about recovery.
Recovery.
Okay, so ask me a question on recovery. So as far as recovery from this type of procedure, traditionally with an open heart surgery, the recovery is long. It's anywhere from 5 to 8 days in the hospital recovering from the open heart surgery. Oftentimes patients are sent to a rehab facility for another week or two to get strength back, and it can take several months for patients to feel back up to norm. This type of valve procedure is minimally invasive. It's done with very small incisions, usually in the groins. Recovery is very minimal. Patients usually walk out of the hospital within 2 days with a good result, and within a week they're up and doing normal activities, and the benefit that they experience is almost immediate. We've had patients very often the very next day tell us that they feel and breathe much better. We've had patients that tell us the very next day they would like to go home because they feel so good. And we sometimes have to say, well, put the brakes on, we'll watch you for another day, and then we'll get you going home. So the recovery is very minimal.
And patients have also said this is life-changing for them.
Oh yes, this is very, these patients are very highly selective. We don't do these types of valves in everybody. We do these types of valves in patients that we believe that they will definitely have a significant benefit with the procedure. So these patients are highly selective. We have a TAVR panel that meets every Wednesday, every week to discuss patients that are on the list to get this type of valve. They are worked up very thoroughly, and we believe we're very good at selecting these patients, and once they get this valve, they will have a significant life-changing benefit.
How important is this program to the overall cardiac program here at Bay Medical Sacred Heart?
Well, we are probably one of 10% of hospitals in the country that are offering this type of TAVR procedure. Of all the hospitals in the country, there's only about 10% that are doing this. So for this type of procedure to be available in Panama City, which is not necessarily the biggest metropolitan area like Atlanta or Chicago or New York, it says a lot for the dedication that Bay Medical has had with this community for years and years. This hospital has been very dedicated regarding their cardiovascular service line to be cutting edge, to get new techniques into this hospital when otherwise smaller community hospitals may not have that drive or that enthusiasm or that motivation to do it. So I really applaud Bay Medical that they really pushed the envelope to get this new technology in this hospital. And there's really no reason to travel outside of Panama City for any type of advanced heart care because we have everything available here, and our results are excellent, our complication rates are low. So it's a good thing for the community.
I think that's a wrap.
Yeah, that's
Good.
I told you he was